Mr. Speaker, the Health Minister is asking doctors to take a pay cut to pay for their scandals, the gas plants, eHealth, and smart meters. Mr. Speaker, back to the Premier. The health quality report found that less than half of patients hospitalized for heart failure or chronic lung disease see a doctor within the week after discharge. For those hospitalized with mental illness or addiction, the numbers are even worse, with more than 2/3 of those patients failing to see a doctor within 7 days of their release. Which is why, Mr. Speaker, the Liberal government's cut to physician services makes no sense at all. The cost of these cuts will not be measured in stats or dollars and cents. The costs will be measured in the suffering the seniors will endure when they wait hours for ER because they can't get an appointment with their doctor if they're lucky to have one at all. Mr. Speaker, does the Premier not care nothing for the suffering that these cuts will inflict on the people of this province who deserve timely, quality health care?
Be seated, please. Be seated, please. Thank you. Minister.
Mr. Speaker, first of all, we aren't cutting the budget for our doctors. Our doctors' budget is increasing by 1.25% this year. It's increasing by 1.25% next year as well. We're bringing in 700 net new doctors into this province this year alone. That's 3 times the rate of population growth. We're continuing to provide the services that people depend on. We're not talking about health services and the delivery of health services. We're talking about one thing, Mr. Speaker. We're talking about compensation to our doctors who are the best paid in the country, as they deserve to be, Mr. Speaker. But I want to get back to that important discussion I had with President Toth of the OMA yesterday, where we provided them with the opportunity to work in partnership with us to create a task force on the future of physician services, to look at a whole broad range of issues, including compensation, Mr. Speaker. We're prepared to negotiate today, tomorrow, going forward, working in partnership with the OMA.